If you have risk factors such as diabetes, let's say you have rheumatoid arthritis, let's say you have some kind of vascular issues or connective tissue disorder, it's really important that you're seeing a specialist probably at least annually, just to make sure that we're performing a proper check, trying to see areas that may be turning into problems in the future so that we can try to prevent that or at least slow the progression.
Let's talk a little bit more about foot health and diabetes. So why is it so important for individuals with diabetes to take care of their feet?
So diabetic patients are at a much higher risk of developing major problems, including higher level amputations. We have a significant problem with diabetes in Kentucky. Approximately 15% of our population is diabetic. About 20% of patients with diabetes will develop an ulceration on their foot over the course of their lifetime. These can lead to infections, which can subsequently lead to amputations. In the United States, studies have shown that there's an amputation of at least part of a foot every 20 seconds. 85% of those are preceded by a wound that has become infected. So the idea with diabetes is to ensure that our circulation is good, to try to maintain our sugars at appropriate levels, which will reduce the risk of those types of complications, and to identify structural issues and other problems that may put them at higher risk of developing those problems.
Is there a certain footwear somebody with diabetes should look into getting?
Ideally, patients that have neuropathy, which is a disease of the nerves that develops as a result of chronically high sugars, or at least this specific type of neuropathy is, it's going to put those patients at a higher risk. And so those patients who also have a foot deformity are at a significantly higher risk. Putting the patient in what's considered a therapeutic diabetic shoe, it just means it has more room in the toe area, make sure it's properly fit in a width to reduce the risk of rubbing, which leads to blisters and ultimately wounds. And we can make special inserts to offload prominent areas. So if they have a prominent bone or prominence in the foot that's at risk for developing a problem, we can offload those so they're less likely to be.